Have you ever gone to bed feeling perfectly fine, only to wake up 1, 2, or even 4 times just to use the bathroom? If you're over 60, you may have accepted this as a normal part of aging. Many people do. They assume their bladder is simply getting weaker, or that poor sleep is something they have to live with. But what if that's not the real reason? I'm Dr. Nathan Ashford, and for more than 24 years I've worked with older adults struggling with nighttime urination, also known as nocturia. Over the years, I've noticed something surprising. Many patients who believed they had serious bladder problems were actually making one simple mistake every day. They were drinking their water at the wrong time. The amount of water wasn't the problem. The timing was. Your kidneys don't work the same way in the morning as they do late at night. Your body follows a natural 24-hour rhythm that controls everything from hormone production to urine formation. When you understand that rhythm, you can often reduce nighttime bathroom trips without cutting back on healthy hydration. Research has shown that adjusting the timing of fluid intake can significantly reduce nighttime urination in older adults, even when total daily water intake stays the same. That's important because many people respond to nocturia by drinking less water altogether. Unfortunately, that often creates new problems, including dehydration, constipation, dizziness, headaches, and even a higher risk of urinary tract infections. The goal isn't to drink less, it's to drink smarter. Today, I'll share the 3 hydration habits I teach my own patients to help them sleep longer and wake up less often during the night. We'll begin with a simple evening habit that almost everyone gets wrong. Then we'll talk about the best time of day to drink most of your water. And finally, I'll explain a hidden cause of nighttime urination that has nothing to do with how much you drink, and it's the reason many people still wake up even after avoiding water before bed. Before we begin, let me ask you a question. How many times do you usually get up to use the bathroom during the night? Leave your answer in the comments below. If you're over 60, tell me your age as well. Your experience may help someone else realize they're not alone. Now, let's start with habit number 3. A simple change that could improve your sleep starting tonight. Habit 3. Stop drinking large amounts of water before bed. Let's begin with one of the most common mistakes I see in my patients. Many people spend the day drinking very little water because they're busy. Then, after dinner, they suddenly realize they haven't had enough to drink. So they try to catch up by having several large glasses of water, tea, or juice before bed. It sounds harmless, but this habit can quietly sabotage your sleep. Your kidneys don't work at the same pace around the clock. As evening approaches, your brain releases a hormone called vasopressin, also known as the antidiuretic hormone. Its job is to help your kidneys produce less urine while you sleep, allowing your bladder to stay comfortable through the night. But if you drink a large amount of fluid within 2 or 3 hours of bedtime, you overwhelm this natural process. Instead of slowing down, your kidneys continue filtering that extra fluid. Your bladder fills while you're asleep, and before long, you're awake with an urgent need to use the bathroom. This becomes even more noticeable after the age of 60. As we age, our bodies naturally produce less vasopressin during the night. That means your kidneys are already less efficient at concentrating urine than they were when you were younger. Even 1 or 2 large glasses of water before bed may be enough to trigger multiple nighttime trips. I remember one patient, Linda, who woke up 4 times every night. She thought she had a serious bladder condition. When we reviewed her daily routine, we found she drank almost half of her daily fluids after dinner while watching television. We didn't reduce her total water intake. We simply moved most of it to the morning and early afternoon, and asked her to stop drinking large amounts, about 2.5 hours before bedtime. 3 weeks later, she was waking only once most nights. The amount of water hadn't changed. Only the timing had. That doesn't mean you should avoid water completely before bed. If you're thirsty, take a few small sips. The goal is to avoid large drinks, not to become dehydrated. Also remember that water isn't the only fluid your kidneys must process. Tea, coffee, juice, soda, milk, soup, and alcohol all count toward your evening fluid intake. Drinks containing caffeine or alcohol can make the problem even worse because they increase urine production and may also irritate the bladder. So here's your first action step. Choose your usual bedtime, then count backward about 2.5 to 3 hours. Make that your evening hydration cutoff. After that, only sip water if you truly need it. It's one of the simplest changes you can make, and for many people, it leads to better sleep within just a few weeks. But avoiding water before bed is only part of the solution. The next habit is even more important because it explains when you should be drinking most of your daily water to help your kidneys work with your body instead of against it. Habit #2. Drink most of your water earlier in the day. Now let's look at the second habit. And in my experience, this is where many people see the biggest improvement. Most older adults aren't drinking too much water. They're simply drinking most of it too late in the day. Think about your typical routine. You wake up and have a cup of coffee. You stay busy throughout the morning and forget to drink much water. By late afternoon or after dinner, you suddenly realize you've hardly had anything to drink all day. So you begin drinking several glasses within a few hours. Unfortunately, this is exactly the opposite of what your kidneys prefer. During the morning and early afternoon, your body is active. Your circulation is stronger, your kidneys are working efficiently, and your bladder has plenty of opportunities to empty while you're awake. That's the ideal time to process most of your daily fluids. But when you postpone hydration until the evening, your kidneys are forced to do their heaviest work just before bedtime. Instead of finishing that work during the day, they continue producing urine while you're asleep. One study found that older adults who consumed the majority of their daily fluids before early afternoon experienced significantly fewer nighttime bathroom trips than those who drank most of their fluids later in the day, even though both groups drank about the same total amount of water. That's the key message. It's not about drinking less. It's about drinking at the right time. One of my patients, Robert, was convinced his enlarged prostate was the only reason he woke up 3 or 4 times every night. After keeping a simple 3-day fluid diary, we discovered that nearly half of his daily water intake happened after 5 p.m. We made one simple adjustment. He started drinking a full glass of water after waking up, continued drinking steadily throughout the morning, and gradually reduced his intake after dinner. Within a month, he was waking only once on most nights, and he felt far more rested during the day. Here's a simple routine you can start tomorrow. Drink 1 full glass of water shortly after waking up. Continue drinking regularly through the morning. Have another glass with lunch. Drink moderate amounts during the early afternoon. After about 5 p.m., begin slowing down. After your evening cutoff, only take small sips if needed. This approach keeps you well hydrated while giving your kidneys enough time to process fluids before you go to bed. And there's another benefit many people don't realize. As we get older, our sense of thirst becomes weaker. Many seniors don't feel thirsty until they're already mildly dehydrated. That's why relying only on thirst often leads to drinking too little during the day and too much at night. Creating a simple hydration schedule is much more effective than waiting until you're thirsty. Now we've covered when to stop drinking before bed and when to drink most of your daily water. But here's the biggest surprise of all. Some people follow both of these habits perfectly, yet they still wake up several times every night. Why? Because the fluid filling their bladder isn't always coming from what they drank. Sometimes, it's coming from somewhere else entirely. Let's look at the hidden cause that many people, and even some healthcare providers, often overlook. Habit #1. The water waking you up at night may be coming from your legs, not your glass. Now we've reached the habit that surprises almost every patient I see. Most people assume that if they wake up to urinate several times during the night, it must be because they drank too much water before bed. But that's not always true. In many older adults, the extra urine produced at night isn't coming from what they drank in the evening. It's coming from fluid that has been sitting in their legs all day. Here's how it works. As you sit or stand throughout the day, gravity naturally pulls fluid into your lower legs and ankles. If you're over 60, your veins and circulation aren't quite as efficient as they once were, so that fluid tends to remain there longer. You may notice your shoes feel tighter by evening, or that your socks leave marks around your ankles. Those are small signs that fluid has been collecting in your legs. Then something changes when you lie down to sleep. Without gravity pulling fluid downward, that stored fluid moves back into your bloodstream. Your kidneys quickly filter the extra fluid, turning it into urine while you're asleep. That's why many people wake up just 1 or 2 hours after falling asleep, even if they didn't drink anything before bed. One patient, Dorothy, insisted she stopped drinking water after dinner, yet she still woke up 4 times every night. When I examined her, I noticed mild swelling around her ankles. Instead of changing her water intake, we focused on improving circulation. She elevated her legs for about 30 minutes before dinner and reduced salty processed foods. A few weeks later, her nighttime bathroom trips had dropped from 4 to just 1 or 2. The biggest reason this happens is too much sodium. Salt causes your body to hold on to extra water. That water often collects in the tissues of your legs during the day and returns to your bloodstream once you lie down. The surprising part is that most sodium doesn't come from the salt shaker. It comes from processed foods like deli meats, canned soups, frozen meals, packaged snacks, fast food, and many restaurant dishes. Reducing sodium doesn't mean eliminating it completely. It simply means choosing fresher foods more often and paying attention to nutrition labels whenever possible. There's another simple habit that can also help. If you spend a lot of time sitting during the afternoon, try elevating your legs for 30 to 45 minutes before dinner. A short walk or a few minutes of gentle leg exercises can also improve circulation and help your body move that fluid before bedtime, instead of during the night. Now think about what happens when you combine all 3 habits we've discussed. You drink most of your water earlier in the day. You avoid large drinks a few hours before bed. And you reduce the amount of fluid building up in your legs. Instead of forcing your kidneys to work overtime while you're sleeping, you're allowing them to finish most of their work before you ever get into bed. For many people, that's enough to reduce nighttime bathroom trips significantly. However, I want to mention one important point before we finish. If you're still waking 3, 4, or even 5 times every night after making these changes, your bladder may not be the only issue. Sometimes, frequent nighttime urination is a symptom of an underlying medical condition, and knowing when to seek medical advice could be just as important as changing your hydration habits. Let's talk about those warning signs next. When nighttime urination is a warning sign you shouldn't ignore. The 3 habits we've discussed can make a real difference for many people. But I also want to be honest with you. Sometimes, waking up several times at night isn't just about hydration. Sometimes it's your body telling you that something else needs attention. That's why it's important to know the warning signs. For men over 50, one of the most common causes is an enlarged prostate. As the prostate grows, it presses against the urethra, making it harder for the bladder to empty completely. Even after using the bathroom, a small amount of urine remains behind. That means your bladder fills up faster, leading to more frequent trips, especially during the night. If you notice a weak urine stream, difficulty starting urination, or the feeling that your bladder never completely empties, it's worth discussing these symptoms with your doctor. Another common condition is an overactive bladder. In this case, the bladder muscle contracts too soon, even when it isn't full. People often describe a sudden, intense urge to urinate that feels impossible to ignore. Some even experience leakage before reaching the bathroom. Hydration habits can help, but medical treatment may also be necessary. Another condition that should never be overlooked is diabetes. High blood sugar causes your kidneys to remove excess glucose through the urine, and water follows that glucose. The result is larger amounts of urine throughout both the day and the night. If frequent urination is accompanied by constant thirst, unexplained weight loss, blurred vision, or unusual fatigue, don't assume it's simply aging. It's important to have your blood sugar checked. Heart and kidney conditions can also contribute to nighttime urination. When the heart doesn't pump efficiently, fluid is more likely to collect in the legs during the day. Once you lie down, that fluid returns to your bloodstream and your kidneys remove it overnight. If you have swollen ankles, shortness of breath, or feel unusually tired with minimal activity, these symptoms deserve medical evaluation. There's one more condition that often surprises people: sleep apnea. Many people think sleep apnea only causes loud snoring. But it can also increase nighttime urine production. When breathing repeatedly stops during sleep, your body releases hormones that tell the kidneys to make more urine. So if you snore loudly, wake up gasping for air, or feel exhausted despite spending enough hours in bed, it may be worth asking your healthcare provider about a sleep study. The good news is that many people have more than one contributing factor. Perhaps mild prostate enlargement, combined with drinking most of their water after dinner, plus a diet that's high in sodium. When each of these issues is improved, the overall result is often much greater than addressing only one of them. Now that you know the most common causes of nighttime urination, let's finish with something practical. In the final section, I'll give you a simple action plan that brings everything together into 3 easy habits you can start tonight to help you sleep longer and wake up less often. 3 simple habits you can start tonight for better sleep. Before we finish, let's bring everything together. If you only remember 3 things from today's video, let them be these. First, drink most of your water earlier in the day. Your body needs water, especially as you get older, but your kidneys work most efficiently during the morning and early afternoon. By drinking steadily throughout the day, instead of catching up at night, you give your body plenty of time to process fluids before bedtime. Second, stop large drinks about 2 to 3 hours before bed. You don't have to avoid water completely. If you're thirsty, take a few small sips. The goal is simply to avoid filling your bladder during the hours when your body is trying to prepare for sleep. This small adjustment alone can make a noticeable difference for many people. Third, pay attention to sodium and leg swelling. If your ankles swell during the day or your diet is high in processed foods, your body may be storing extra fluid that returns to your bloodstream after you lie down. Reducing sodium, staying active, and elevating your legs for a short time before dinner can help your kidneys remove that fluid while you're still awake, instead of during the night. When you combine these 3 habits, They support each other. Your kidneys do more of their work during the day. Your bladder stays quieter at night. And you give yourself a much better chance of sleeping through the night. Remember, don't expect perfection after one evening. Healthy habits take time. Some people notice improvement within a few days, while others may need several weeks before seeing consistent results. The important thing is to stay consistent. If, after trying these strategies, you're still waking up several times every night, or your symptoms continue to worsen, don't ignore them. Speak with your healthcare provider to rule out conditions such as diabetes, prostate enlargement, heart disease, kidney disease, or sleep apnea. There's no shame in asking for help. In fact, the earlier you identify the real cause, the easier it often is to treat. Before we end today's video, I'd like to ask you one question. Which of these 3 habits do you think will be the easiest for you to start tonight? Will you begin drinking more water in the morning? Will you stop large drinks before bedtime? Or will you start paying closer attention to your sodium intake? Let me know in the comments below. I enjoy reading your experiences, and your question might even inspire a future video. If you found this information helpful, please take a moment to like this video and subscribe to the channel. Every week, I share practical, science-based health advice designed especially for adults over 50. Simple habits that can improve sleep, protect your health, and help you enjoy a better quality of life. Thank you for watching. Take care of yourself, sleep well, and I'll see you in the next video.